Well, good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Tuesday, April 28th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief, and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Thank you, Brad, and good afternoon. Before we begin to provide the updates on the COVID-19 response for today, I want to acknowledge that today, April the 28th, is the National Day of Mourning for persons killed or injured in the workplace, also known as Workers' Mourning Day. Today, we remember and honor all of those who were killed, injured, or who suffered illness due to workplace-related hazards and incidents. We also hold in our thoughts, of course, all of the families and the friends and the colleagues who've consequently been affected by such workplace tragedies. In commemoration of all those who lost their lives due to workplace-related hazards or incidents, we have lowered the Canadian flag in Nathan Phillips Square, and we have dimmed the Toronto sign. This year, we, as part of this day, recognize the frontline workers confronting COVID-19, a pandemic unlike anything we've seen in our lifetime, and the need for us to remain steadfast in our commitment to ensuring the health and safety of the workers involved in helping us fight that virus. In addition to the historic loss of life and injuries experienced by workers generally, we also mourn today the workers who've lost their lives to COVID-19 as they fought to protect the health of our community and to save lives, just as we honor those who have fallen ill with COVID-19 as a result of their work on the job caring for us. Preventing workplace deaths and injuries and diseases can only be achieved if we collectively focus our efforts on creating safe and healthy workplaces through prevention, education, and communication. The health and safety of all of our staff is of the utmost importance. I want to stress that divisions across the city are working tirelessly and have been throughout to protect worker health and safety throughout so many different workplaces across the city. The Emergency Operations Centre remains diligently focused on ensuring that our frontline staff, who serve our most vulnerable residents in long-term care homes and in our shelter system, have the personal protective equipment that they need to keep themselves and others around them safe and healthy. I'm proud of the work that the city is doing to protect workers from the risks that they face simply by doing the important work that they do. It is critical that we continue to do as much as we can to keep our workplaces as safe as possible, because it is the right thing to do, but also in memory of all those who've tragically lost their lives while just doing their jobs. One thing that the COVID-19 pandemic has shown us is that it is more important than ever to have access to reputable health information and vital services online. And that as we try to keep our physical distance from others, it has shown us as well that we need to be more connected electronically. Technology is now crucial to connecting with loved ones, working remotely, getting an education, and for that matter, staying healthy. As you know, we have been encouraging Torontonians to stay home as much as possible. For those without regular access to the internet, this can be extremely difficult, and it can even be harmful to their overall well-being. Adding to that difficulty, our libraries and community centres, many of them, where people often access the internet, are completely closed to the general public to stop the spread of COVID-19. We're happy to announce that in partnership with some technology and telecommunications companies, the City of Toronto has been able to coordinate free, temporary internet access for many vulnerable Torontonians, including residents in lower-income neighbourhoods, seniors in long-term care homes, and clients in many city-operated shelters. I would like to highlight a few of these projects and the partners involved. To provide free internet to low-income neighbourhoods, the city received generous donations to connect 25 residential apartment buildings with temporary free internet access. The first buildings in low-income communities will begin receiving this access early next month. And I'd like to acknowledge Cisco Canada for providing hundreds of permanent mobile access points, as well as Onyx Canada, BAI Canada, and Beanfield MetroConnect for providing installation, servicing, and maintenance needs. I'd also like to thank Civic Tech Community for volunteer labour, and lastly, Bell Canada for providing free access in up to 10 of those low-income buildings so as to ensure that all users can access this service. To prevent the spread of COVID-19 in city-operated long-term care homes, visits from family and friends were suspended, and the Wi-Fi-enabled common rooms were closed. The city's Technology Services Division has recently expanded free 24/7 Wi-Fi access for seniors living in these homes. These new Wi-Fi hotspots in the long-term care residences will allow residents to practice physical distancing while at the same time staying connected to friends and to family to help alleviate the feelings of social isolation that many of them are experiencing. Rogers is donating free Wi-Fi for 3 months to 4 permanent City of Toronto shelter locations and has also installed free Wi-Fi in 5 temporary shelter locations to help facilitate physical distancing during the pandemic period. This will ensure that there is coverage throughout the shelter to allow those experiencing homelessness to access important online supports and services. And finally, through a partnership between the City, Telus Mobility for Good program, the Toronto Police Service, the United Way of Greater Toronto, and lead community service providers, eligible vulnerable Torontonians have received a cell phone, data plan, or a SIM card free of charge to help stay connected during the time of the pandemic and to access mental health and other crisis services during this difficult time. These resources were distributed through Focus Toronto service agencies and the Toronto Mental Health Support Plan to their clients based on their assessment of need. I'm very proud of the collaboration that went into making all of this work possible. And again, I want to thank each of these technology and telecommunications partners for stepping up and providing their services to help those most in need. These are exactly the kinds of partnerships that I want to see the city putting together during and after the pandemic. And it should be noted that these partnerships are coming together and new services are being provided at what I've called wartime speed. Right now, the city is doing everything it can as a municipal government to help people with the assistance of the private sector, the not-for-profit sector, and individual residents, many of whom are volunteering across the city. I've said throughout this crisis that we're all in this together, and this is one more example that proves that. Technology, now more than ever, is helping us to stick together and to stay connected and to fight COVID-19. I'm confident we will win this fight and will make sure that our city comes out stronger than ever, more connected than ever, and more focused on helping each other than ever. And now it is my privilege to introduce Dr. Eileen Davila, our Medical Officer of Health, for her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. For today's update, as of 11 o'clock this morning, there are 5,128 people infected with COVID-19 in Toronto. This includes 4,647 confirmed and 481 probable cases. We have 319 people in hospital and 109 in intensive care units. In total, we have lost 305 Torontonians to this virus. On behalf of my team, I extend deepest sympathies to those who have lost loved ones and send well wishes to those who are sick and recovering from this illness. I've updated you on these numbers every day for the past several weeks. However, we must remember when we reflect on these numbers that they represent our friends, our family members, and our loved ones. There isn't a moment of any day that goes by that I don't think about this. I also worry about how everyone is coping through these extremely difficult times. I think about this at the end of every day. I know that these circumstances are stressful, and I am mindful of the toll that this situation is having on families throughout our city. Yesterday, I shared some simple measures we can all follow to promote and preserve mental health and resilience. Today, I thought it would be helpful to share some information to help children cope through this pandemic. COVID-19 has changed all of our lives. It is a very challenging time for children, some of whom might not understand reasons for school closures and other physical distancing measures. Understandably, many are feeling anxious or worried. For our children, being at home right now feels different from your regular weekend or vacation. They no longer have the freedom to see their friends or to go outside when they want to. Children look to us as trusted adults to find out how to deal with new situations, and they also respond to stress they may be experiencing in different ways. There are some simple things we can do to help children cope during these stressful and uncertain times. Keep up healthy habits and routines as much as possible, or create new ones that include learning. Provide facts about what is happening and give clear information in an age-appropriate way. Listen to concerns, acknowledge their feelings, and provide reassurance. Help children to understand the importance of hand washing and think about making it fun for younger kids by singing a song. And explain physical distancing measures and include your children in phone calls and video calls with your loved ones. It is also important that we remind our children that they have an important role to play in reducing the spread of COVID-19 by staying home. When you stay home as much as possible, you are helping to keep our city healthy and those that take care of us safe. Thank you to everyone in our city who is doing their part to help get our city back. We can't do this without you. So please, continue to stay home, stay safe, and take care of each other. I'll now hand it over to Chief Pegg.
Thank you, Dr. Davila, and good afternoon. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. All aspects of EOC operations continue to operate 7 days per week, ensuring that both critical and essential services are being provided without interruption. I'm proud of every member of our City of Toronto team who continues to work hard in support of our residents each day. This morning, I met with Mr. Saad Rafi, who, as you know, is now leading the city's Recovery and Rebuild Office. While as a city, we are still very much working our way through the response to COVID-19, our teams are connecting proactively and will work together in collaboration as we plan for the transition from response to recovery. In my role as the COVID-19 Incident Commander, I will ensure that our EOC and associated COVID-19 response teams remain directly connected with Mr. Rafi's teams, such that a well-coordinated transition to recovery is achieved. From an operational perspective, our personal protective equipment levels remain stable, and our team continues to work hard to source the equipment that we will need on a go-forward basis. I am pleased to report that we have taken delivery of 50,000, that's 50,000, additional face shields that are now being tested and evaluated before being placed into inventory. An additional 150,000 face shields are also expected to arrive in Toronto over the next 2 weeks. In closing, I also want to acknowledge and thank every resident, business owner, and everyone in our city who is being impacted as we do our very best to stop the spread of COVID-19. We are truly all in this together. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll go to questions. Reporters on the line, please remember 2 questions each. And we also have on the line Marianne Bedard from Shelter Support and Housing and Paul Raftis from our Senior Services and Long-Term Care. First question is to Chanel Call from CP24. Chanel?
Hi there, Mayor. Thanks for taking my question. I want to ask you about some new data that Minister Christine Elliott referenced today that shows 35 people may have died because they couldn't get the cardiac surgeries that they needed so that hospital beds could be left open for potential COVID patients. Just wondering what your response to this is. And of course, given that Toronto has so many major medical centres, will you be pushing the Premier to begin offering those surgeries once again soon?
That question was directed to me?
That's right.
Yes, it was.
It was to me?
Yes, sir.
I think obviously these are very difficult decisions to be made in a situation that was unpredictable with regard to the course that this virus has taken, and it's not finished yet. Obviously, they will make those decisions, meaning the people in charge of the Ministry of Health and the hospital system in Ontario, based on what is their best judgment at any given point in time. And so I haven't been a particular advocate with respect to those matters because they don't fall within our domain, but I'm sure they're making decisions based on what is in the best interests of all of the patients that they have to serve, whether they be COVID-19 or anybody else.
Thank you. And just one more question, this one with respect to reopening the city. In your discussions with the Premier, have you determined any plans so far for which businesses are going to be part of stage one, and any ideas for how they'll be chosen?
No, I took interest in his, three-stage framework that was put out yesterday, and I'd had some discussions with him about that. But I think the important part that I took note of and that I'm focusing my efforts on is getting to phase one. And the framework document was very clear in saying that we have quite a bit of work to do over a period of what they said could be 2 or 4 weeks or longer to make sure that we have a steady downward trend in the numbers. So that, to me, we're continuing to be focused while we do all of our planning work on getting people to continue to physically distance themselves. And we're doing all the planning work, but we're not worrying about dates for the moment simply because we're not at a stage where we can worry about dates. And I guess he and I and others will discuss that when we get closer to the time when the numbers justify the beginning of a first phase of reopening.
Okay, thank you. We'll go to Matt Bingley now from Global News. Matt?
Hi, Dr. Davila. When it comes to the case counts, we've just seen we're now surpassing 5,000 cases in Toronto. When you see over the past 12 days this 2,000 case increase, I'm just wondering if there's anything in that that really concerns you.
Well, Matt, insofar as we're talking about health effects on our city, it of course concerns me. However, as we look at our data, and as I demonstrated last week, and we continue to still monitor the data as that is part of our role, we are seeing flattening of the curve, what we believe is flattening. And as I indicated, it appears that we are in our peak period. This being said, the most important thing right now is for the population of this city to continue to stay the course. We must continue on with our physical distancing measures if we are to get to the other side of the peak, which we will not really appreciate until we're past it. So again, I would encourage people. I know it's difficult, and it has been several weeks now of physical distancing measures, but it is exactly what we need to continue to do if we are to get ourselves to the point where we can think about, as the Mayor said, thinking about a phase one and a reopening to get our city back.
When you look at all of that data as a whole, be it around 2,900 people have recovered, but you're still seeing these numbers rise. What is it exactly that you're looking at as the most important number in all these subsets right now?
Well, I don't think that there is a singular number that we look at. I think as you do when you consider any patient, you can't focus on one singular test or one single result. You actually have to look at the patient in totality. And that's certainly what we're doing here. I think one thing that's important that we've tried to emphasize through our conversations with you and with the public is that we know that there is increased testing happening as well. So we should expect to see case numbers go up. And while that is concerning, the good part about having more testing available is that it helps us actually to direct resources and to direct our public health actions to where they're most needed. So we will continue to monitor all the numbers. so that we have a fulsome picture and a fulsome understanding of what's happening in our city and how best we can direct our resources to bring the situation to control as soon as possible.
Okay, thank you. We'll go to Mike Crawley now from the CBC. Mike?
Hi, my question is for Dr. Davila. Dr. Williams just said that he wants public health units to provide more information about where transmission is happening currently out in the community. So I'm wondering, what does Toronto Public Health know about how the virus is spreading outside of institutions? Is this happening in workplaces that are open, or is it supermarkets where they're not doing such a good job of physical distancing? Is it people passing one another on the sidewalks? What do you know about how community transmission is happening currently?
Well, I haven't yet had a chance to hear Dr. Williams' remarks, so I will look forward to having that opportunity. But what we know from our data right now is that a significant risk factor is close contact, and in particular household contact with a COVID-19 case. We know that there are, we've talked about this last week when we showed data, that there are also risks within congregate settings, long-term care being an example. Because of the nature of the work that happens there, it's very difficult to provide the kind of care that needs to be provided in long-term care and to maintain physical distancing. So we know that that's another circumstance within which we see transmission in our community. But, you know, as per the answer to the previous question, we are constantly looking through our data. I'll look forward to having a listen to what Dr. Williams recommended that we should be doing at local public health, and we'll continue to work with him and our other partners around the province to make sure that we're able to provide information that helps our public, but also helps us direct our actions as we respond.
And that's actually precisely what I wanted to follow up on. How could it help to have more precise data about where people are coming down with COVID-19 to help you focus your public health efforts, your resources on the primary sources of infection, so that there's maybe an opportunity for less emphasis on the places where infection is less likely?
So I think you've already hit exactly on that answer, particularly as we start to think about reopening our city, understanding what the major risk factors are and where those risk factors are found will help us determine how best we can reopen in our city in a way that's safe and actually best protects the health of our public. This is exactly what we're going to be thinking about as we proceed in the days and weeks to come.
Thank you. We'll go to Mark McAllister now from City News. Mark?
I might as well follow up with Dr. Davila first. I'm not sure if anybody had the opportunity to ask you yesterday, and I wasn't on the call. Apologies. Just the huge jump in recovered numbers. Obviously, something has changed with the way Toronto Public Health is calculating the number of cases that have recovered. It went from hundreds to thousands. Could you explain that?
So, Mark, as you may recall, we introduced a new information system just recently to help us better manage our data. Our existing system, the one that we'd used for many years, had served us, as I said, for many years, but wasn't robust enough to manage the data at the speed we needed it to be managed at this time. So with our new information system, we were updating information and making sure that we had our data appropriately accounted for in that system. We were then able to provide more up-to-date numbers on those that had recovered. Hence, you saw the increase in the number of Torontonians who have recovered from COVID-19.
So what was the difference in the way it was being calculated, however? How does it make such a huge jump, and what determines a recovery, if that's the case?
Well, it's largely around the information system more than it is around the determination of recovery, but there are different methods by which people are moved into the category of recovered from COVID-19. One method is to actually have testing to prove that they have cleared the virus. Another method that is promulgated, and actually these definitions are provided by our counterparts at the Ministry of Health. The other method, for example, for being moved into the category as having recovered is having passed a certain number of days since the onset of symptoms. So there are different classifications depending on which person we're speaking of, and what category. Healthcare workers are managed slightly differently than are, say, members of the general public. But overall, what we were able to do in terms of being able to better report on those that had recovered from COVID-19 was due in large part to our improved information system.
Thank you. We'll go to Mike Walker now from CTV News. Mike?
Hello, and thank you for taking my question. I'm just following up from yesterday's announcement from the Curb TO plan that was announced this afternoon. We saw city crews setting up the barricades outside some of those essential businesses in the core. We've heard from advocates who have been calling for this as well. Just wondering why not entire curb lanes are being used and only selected in front of the grocery stores or the other essential businesses. Advocates have been calling for entire curb lanes to be barricaded to allow more space for pedestrians.
Well, what we've done, I think, is a common sense approach that is based on the real need. And we have both had public health and the Transportation Services Department assess places where congestion was brought to our attention and have created space adequate to both relieve that congestion in front of those different places of business or community service organizations, and at the same time allow for pedestrian traffic that's going by and not stopping or lining up to do so in a physically safe, physically distant manner. And I think this is the sensible way to do this. There were people calling for all kinds of lanes and random lanes and streets to be closed, but when you actually looked at those streets, first of all, there wasn't really a problem in many of those places at all with anybody on the sidewalks, but secondly, and much more importantly, the medical officer of health did not want to create a situation where those became attractive places for large crowds to gather, thus totally interfering with the mandate we have to try and encourage physical distancing. So I think what we've done is sensible. I think it is flexible because we have up to 100 sites that we have provided for, and we will look at the future when we get there. But for now, I think this is a very sensible approach to take, and one that I think will meet with the favor of most fair-minded Torontonians.
Thank you very much.
Okay, thank you, Mike. We'll go now to Jennifer Pagliaro from the Toronto Star. Jennifer?
Hi there. I wanted to ask the mayor about a letter Minister Clark sent to the federal government about residential rent relief. The Prime Minister responded in his press update that quite definitively that the federal government thought that that was the provincial government's responsibility. And I just wonder if you've had conversations with either government about the need for residential rent relief and what you think about such a program being implemented.
We've not had in-depth discussions with the provincial or federal governments about residential rent relief. There have been some discussions that arose out of the original ban on evictions put in place by the provincial government. We've spent more of our time in the interim between then and now really trying to advocate to landlords, including my gathering together with them virtually, to encourage them to adopt a pragmatic case-by-case arrangements with tenants to make sure that they felt that they could, for example, defer some rent and amortize the paying back of that deferral over a long period of time, perhaps even the balance of the lease. Historically, in our country, of course, relationships between landlords and tenants have been in the purview of the provincial government, but I take note of the fact that the recent program with respect to commercial landlords was a joint federal and provincial undertaking, and so obviously this is something in which the municipality is just not financially positioned to participate, nor do we have any legislative role over those kinds of landlord-tenant relations, but certainly if those governments were contemplating some kind of a program, we'd be supportive of it for those who have not been able to make pragmatic arrangements with their landlords.
Just on a separate topic, when it comes to reopening, just looking at the provincial plan and knowing that the city is working on its own plan, I'm just curious about the way in which daycare works into those plans. Obviously, having workplaces reopen, but there not being daycare to send your children would obviously pose a lot of problems for a lot of residents. I just wonder what considerations are being made.
Well, obviously, we're guided to some extent by what the province decides to do with regard to schools and childcare centres. That's why a lot of these decisions are going to have to be made hand in hand with one another. And obviously, the kinds of things Mr. Raffi and his group, subject always to the public health advice they receive from Dr. Mowat and others, are going to have to determine is the sensibility and practicality of reopening certain workplaces without having childcare available for the people who work there. It's not going to be of as much utility to those people who want to go back to work and who need to go back to work for income-related purposes and perhaps even just for the purposes of their own well-being, to be then able to do so but without any childcare available. So that's the kind of thing that makes this all a puzzle that has many pieces that have to fit together, and that's precisely the kind of work they're doing, in addition to looking at other considerations like public transit and testing and a host of other things, and that's why it's such a big job.
Okay, thank you. We'll go to Alex Bezikovich from the Globe and Mail. Alex?
Hi, thanks for taking my question. Can you hear me?
Yes, we can.
Excellent, thanks. So this is for Dr. Davila. Dr. Davila, I'm trying to understand or to unpack the thinking that's gone into the city's policy around this curb TO effort. Many major cities around the world are doing significantly more to create space for pedestrians and cyclists to use streets while maintaining a safe distance. So you have said, and the mayor echoed a moment ago, that you think that this kind of change could encourage people to congregate in the streets. So I guess I'd like to know, could you clarify what your advice has been specifically to the mayor? And then if you do think that this sort of change is going to encourage people to congregate, can you sort of explain what sort of examples or evidence you're drawing on to make that decision?
So, simply put, as the mayor indicated, what we have put forward in this program is an evidence-informed approach to address issues that have been identified thus far and to help address the challenges that have been seen in particular locations, or hotspots as we call them. But at this time, given what we understand of COVID-19 in our community, our primary message continues to be for people to stay home as much as possible. So given that, we felt that we were trying to balance needs here to address particular hotspot challenges such as they exist right now in order to promote physical distancing and to allow for those businesses to operate and for patrons to make use of the services and products of those businesses in a safe fashion without encouraging people to be outside when we're in fact what we're trying to do is encourage people to still stay at home as much as possible in keeping with our physical distancing measures. This being said, I hear you speak of cyclists and pedestrians, and please know from a public health perspective, I am a strong proponent of active transportation. There are many benefits to active transportation. However, at this time, the overriding health concern has to do with COVID-19, and so the overriding advice in terms of dealing with the current situation is to promote physical distancing and, in fact, to encourage people for now to stay at home as much as possible.
When people, if I can just ask one follow-up question,
Yep.
I mean, the basic rationale for this kind of policy in a number of cities in North America, in Europe, in South America as well, has been that as people are out walking or cycling, that it is very difficult for them to maintain social distance while remaining on the sidewalk. I mean, a typical Toronto sidewalk is barely 5 feet wide. So, rather than, do I hear you saying that is the underlying assumption here that by closing a number of streets or restructuring a number of streets that this would somehow encourage people to be outside more? Because that seems to be, the logic in other cities seems to be that allowing people to use many streets to get around is not having that effect. It's not the assumption other cities are making. Can you explain why you're coming to this sort of quite different conclusion?
So I can't speak to the circumstances in other cities, but in speaking to my counterparts at Transportation Services, in fact, my understanding is that pedestrian volume is not an issue in most places. It's significantly reduced. And the concern is that we want to encourage people for now, at this time, given COVID-19, to stay home as much as possible. and to observe physical distancing measures. Hence our evidence-informed approach to this particular program.
Okay, thank you. Final question now to Brian Passafume from the Toronto Sun. Brian?
Good afternoon. First question's for Chief Pegg. Do you have any information or numbers on tips received through the city's online COVID-19 non-compliance portal?
Brian, I don't have those volumes with me today. We can have a look. What I will say, though, it's important to clarify the access portal relating to 311 is just another means of linking into 311. So when someone accesses the portal, it is accessing the same service request process that someone accesses when they dial 311. So I will endeavor to take that away. We can likely get you some incoming 311 data for you, but I'll have to get back to you.
Okay, no problem. Second question's for the mayor. A lot of private sector businesses, mine included, have announced pay cuts during the COVID-19 emergency. Does City Hall or the city have similar plans to cut salaries to reduce costs?
We don't have any present plans to implement pay cuts. We have, of course, ended up redeploying and in some cases placing on emergency leave some of our employees who were not able to perform their jobs. Most of our employees, the vast majority, would be employed pursuant to collective agreements, and so it is not within our purview to simply in some unilateral way alter the pay scales that are provided for in those collective agreements. But as a result, what we've done is we've made adjustments to the workforce based on these discussions held directly with the unions, and I'm grateful to them for the fact they have sat down with us and negotiated something that did allow for these emergency leaves and also allowed for widespread redeployment of workers in order to help with areas that had particular need, like long-term care in our shelter system. But there have been no pay cuts, and in many cases it wouldn't be possible for us to unilaterally impose any such pay cuts, even if we had any desire to do so, which at this time we don't.
Okay, thank you very much, everybody. That concludes today's media briefing. We will see you again tomorrow at 3:45.